The 6 independent experts are expected to release the final report in July. But based on the current analysis, errors and misjudgment were made that prolonged and deepened the Ebola crisis in some parts of West Africa. The chair of the panel, former Oxfam chief Barbara Stocking, says the World Health Organization waited too long before declaring the Ebola epidemic in West Africa an international public health emergency.
This is a defining moment for WHO. We all know that the world failed in holding back the escalation of Ebola. And it wasn't just anything the WHO's fault. That was a much wider view of how the international community responded and so on. But it does mean that WHO, as part of that, wants to reflect on how it operated. And that's why we are looking very hard at what it could have done differently.
The World Health Organization has been criticized by many NGOs, like Doctors Without Borders, which denounce its slow process. In May 2014, Doctors Without Borders went out publicly, saying a serious epidemic was ongoing, that they needed the international community and organization to deploy more staff. But it was not until August 2014 that the World Health Organization declared the outbreak an international public health emergency. However, Stocking refused to put all the blame for the slow response on World Health Organization alone. She says the organization needed to consider reforms since it still didn't have the resources to face any new international emergencies.
That is our key message to the member states for the World Health Assembly. It's really about making a decision that they really know that and accept that WHO should be this emergency agency. And if so, they have to be prepared to put the funds in and also, in a combined way, hold WHO to account.
Meanwhile, the World Health Organization has declared Liberia Ebola-free. The West African country was declared Ebola-free after 42 days without a new case of the virus, which killed more than 4,700 people during a year-long epidemic.